Hello, I'm Dr. David Danish, a double board certified child, adolescent, and adult psychiatrist specializing in the treatment of ADHD across the lifespan. Today, I'm excited to talk about one of only 2 FDA-approved transdermal stimulant patches for ADHD. It's called Daytrana, and it is methylphenidate extended release. If you're exploring treatment options for a family member who struggles with pills, sensitive digestion, or chaotic early mornings, Daytrana patches might be a perfect fit. Again, this is a methylphenidate patch that delivers medication through the skin, so no swallowing, usually no or much less stomach upset, and a lot more flexibility in timing. Let's take a closer look at what Daytrana is supposed to do, the common side effects, and where it really shines, or doesn't, in clinical use. Daytrana contains the same active ingredient as Ritalin, Concerta, medicines you've probably heard of. It's methylphenidate. But instead of being taken by mouth, it's absorbed slowly through the skin. This bypasses the digestive system entirely, which helps reduce some of the peaks and crashes we sometimes see with oral medications. It's FDA approved for children with ADHD starting at age 6. It's commonly used off-label in adolescents and adults who need non-oral stimulant options. Here's one important thing to know. Daytrana takes about 1 to 2 hours to really start working. That's because it has to move through several layers of skin before entering the bloodstream. So if you're aiming for coverage during school hours, it needs to go on well before the day begins. Let's start with the most common side effect, skin irritation. About 20 to 50% of users notice redness, itching, or mild discomfort at the patch site. These reactions are usually manageable with site rotation, changing the location each day, and some basic skincare. But in some cases, allergic dermatitis can occur, and that may mean switching medications, unfortunately. Along with other stimulants, appetite suppression, insomnia are also common, especially if the patch is worn for too long. Of course, one nice feature of Daytrana is that you can adjust the wear time. You just take it off when you feel like it's not needed anymore. Most kids wear it for 6 to 9 hours, but taking it off earlier in the afternoon often helps with preventing insomnia, as well as allowing them to get that hunger back before bedtime. Because of the slow absorption, Daytrana does not have the quick onset you get with some oral stimulants. That can be frustrating for families who need rapid morning coverage, but it's also why some parents apply the patch while their child is still sleeping. This allows for easier mornings in a lot of cases. There are also the less common but important side effects common to all stimulants. These include a chance for an increase in tics, mild dizziness, higher heart rate, higher blood pressure. If it's a bad fit altogether, it can lead to manic symptoms in very rare cases. If there is any family history of heart problems, I strongly recommend getting an EKG before starting any stimulant, including Daytrana. I often prescribe Daytrana for kids who are sensitive to medications that go through the gut, or simply can't or won't swallow pills. It's also a great option when mornings are rough and you need symptom coverage as soon as your child gets up. The flexibility is a huge plus. You're not stuck with a set duration like you are with pills. You can take the patch off earlier if it's causing side effects or if they simply don't need the patch after school. That gives parents a little more control, which can make a huge difference. I will say I do see a fair number of patients with skin reactions, closer probably to 40% than that 20%. You really have to rotate the site to avoid putting it on irritated or sweaty skin. And of course, it takes a little planning since it doesn't kick in right away. But when it works, and it often does, it can be a total game changer. The clinical response rates are excellent, and for the right patient, it can offer all the benefits oral methylphenidate can without the daily pill battle. Daytrana is a flexible, gut-friendly option that can simplify mornings and reduce medication stress for families. Like all stimulants, it's not perfect and it requires thoughtful monitoring. But when prescribed for the right reasons, it can truly improve quality of life. If you want a deeper dive, like how to apply the patch, manage skin issues, or compare Daytrana to oral methylphenidate, head to the Mind Vault on drdaviddanish.com. That's where I keep all the visual guides, side effect breakdowns, and my comprehensive list of all on and off-label medications for ADHD. Thank you for watching, and I hope this helps you or your child get one step closer to the right treatment path.